Well, good morning, everyone. Just making sure I'm on here. There we go. Good morning from St. Bart's in Midtown Manhattan. Whether you're joining us in person here at the church or joining us online, we're so glad that you're here. My name is Peter Thompson. I serve as the vicar here, and it is my delight and joy to welcome you to the forum where each week we hold sacred conversations about the things that matter. And on this 21st anniversary of the 9/11 attacks, this morning we're going to be having a conversation about the long-term health effects, both physical and mental, of those attacks. And we're very honored to be joined by Dr. Jim Cohn, who is the medical director of the World Trade Center Health Registry, which is a part of the New York City Department of Health. And I believe you've been doing this for 20 years.
That's right.
Since about a year after the attacks.
Mm-hmm.
It's a real honor to have you here to talk about this really important topic, the long-term effects that this disaster has had on the rescue workers, the people who were there at the site, and on everyone.
Yeah.
So thanks so much for being here.
Well, thank you for the invitation. Today is, of course, September 11th, and every year I think there's always been a sense that we need to remember and understand better what happened and what we could do in the future to take care of the people who survived. How many of you were here during 9/11? Almost everybody, yeah. So it's one of those events that many of us, can't forget, unfortunately. And many people would say, "I know where I was and what happened when I heard the news." So it's one of those kind of events that is it's a time mark in most of our histories. It's an important question because long-term health effects of a building collapse after a terrorist attack, unfortunately, are lessons that we keep having to, I think, learn. Certainly the events of the war in Ukraine is another example of many building collapses due to bomb attacks. So it's not something that's only in the past. This is something that we will have to understand and use the information in the future, unfortunately. So why am I here, I guess, is one question you could ask. And I was in California. I was the director of the occupational health branch for the state of California Health Department. And I was actually on my way and on the subway to go sign charts at San Francisco General Hospital, and I also was teaching at the hospital. And I got a call from my coworkers who were located in a tall high-rise in Oakland, California, not far from the airport, and they said, "Something bad is happening in New York, and you need to come back to our offices." And of course, everybody was kind of concerned. What could happen next? There were reports of other attacks. Of course, the Pentagon, other planes were also hijacked. So there was a concern, and then we decided to evacuate the building. It was very close to the airport. So we said, "This is a high-rise, not far from an airport. Why don't we just have everybody go home?" So we did, and I think that happened around the country. People were very proactive and decided better to be cautious and not knowing what really happened. So after that, my wife had moved to New Jersey to teach at Rutgers, and I just decided to come to New York. I was invited by the Commissioner of Health to come and help with the environmental health consequences of this disaster. And that's where I've been ever since. I've been very interested in trying to provide the data that we can use then to understand better what happened and what were the consequences, and then what does the future hold for people who were rescue workers, like you mentioned, the community residents, the teachers, the students who worked and went to school in the neighborhood. There are a lot of area workers and people who were just passing by that day. It was, as you may recall, an election day. There were people in the street. There were estimated about 400,000 people who were actually exposed to the falling debris, the dust, the noise. and all the toxic contaminants that came from the burning of the Twin Towers and their collapse. And there were actually 7 other buildings that were damaged in the neighborhood. One actually collapsed in the afternoon of 9/11, Building 8. So it was certainly a horrendous experience for anybody who was there, who was close by. And as the Commissioner of Health at that time, was a psychiatrist, he immediately thought about, well, what do we do about the fact that this has happened to so many people? What should we do to try to develop a program that would address the immediate problems? They opened a clinic at the health department to take care of the injured. They also thought about what would the long-term health effects immediately. Within a few weeks, there was discussion about what do we do to try to document the true kind of long-term health effects. And it was a lot of foresight, because the issue was, how do you make sure the community and the workers are treated with respect and not inundated with lots of studies that would be kind of painful. So I think the question was, well, using what tools we have, what can you do to try to document such an event? And the tools are usually the tools of epidemiology, which probably you've heard of since COVID. Epidemiology is a study of diseases in populations, and some of the principles of epidemiology are counting. That's probably something you heard a lot about during COVID, is how many cases there are and how many people have been vaccinated. And then the second principle of epidemiology is the denominator. What's the count from? What population is it from? And can you develop a rate or a number of cases per unit of time or place? So those principles are really the principles that guided the development of follow-up for 9/11. And there's another science that is also useful in this kind of situation. It's called toxicology. This is the science of studying the toxic effects of exposures, things that we are exposed to either every day or in unusual circumstance. So toxicology is the other specialty or the discipline that I was studying as part of my training. So the combination of those two, then we begin to be able to see and predict maybe what are the potential health effects. And we began thinking, given the fact that the dust was the biggest probably physical health danger, what else might be an issue after a collapse of a building? Well, this Commissioner of Health, being a psychiatrist, said you need to pay attention to the mental health. Their mental health, of course, is very wrapped up with our physical health, and they're hard to separate the two, but we need to always think about not just the physical threats of exposure, but what does it mean for people after an event like this? People were asked to evacuate. Evacuation is another major response to a disaster. But I just have been conducting a study of the evacuation. It was a mandatory evacuation. The mayor declared an emergency, and unfortunately there are people who cannot evacuate. So I heard stories from people who said, my mother was bedridden and I couldn't evacuate. I had to take care of her. There are other people who didn't have a place to go. Other people didn't have a way to go. So evacuation is a very important thing to plan for, and that's something I've been really concerned about, is we need to learn the lessons. Evacuation after Hurricane Sandy had some of the same problems. Some people could evacuate, some people had to stay in their homes. Like some people, were on the 18th floor of a high-rise and the electricity went out in Lower Manhattan. You probably remember, some of you who were here. So there are always these challenges after a disaster. How do we prepare, and then what lessons can we learn from the 9/11 experience, Hurricane Sandy, and any future disaster? We then set up a way to count the effects of 9/11. And what's the best way to do that? Well, if you think about it, who was exposed to the events of 9/11? If you think about it, probably everybody in New York City was affected in some way, either directly or indirectly through television, and people around the country and around the world saw this on television, so they may have been some sort of an effect. We thought about it. Excuse me. And there's always a problem in epidemiology of defining who's exposed. And that was one of the main challenges. The Commissioner of Health and the Centers for Disease Control decided that it might be good to set up a registry of those people who were exposed. And then there was a clinic set up at Mount Sinai for the workers initially, and then another clinic set up at Bellevue and other health and hospitals around Lower Manhattan to try to treat the injured and treat the people who were exposed. So that there was medical care available through foundations initially in the city. So that one issue we addressed was, how do you count who was affected? How many people went to emergency rooms because they were injured? That's one way to kind of judge what was the immediate effect. But then the long-term effects would need to follow a group of people over time. So there was a decision made by the Centers for Disease Control and the Federal Emergency Management Agency agreed to fund a long-term study. And that was something that we call the Registry, World Trade Center Health Registry. And that resulted in a study that recruited, out of the 400,000 people we estimated were exposed, we were able to recruit 71,000. It's not a perfect study in the sense people volunteered. It was people who saw an ad or talked to one of our recruiters. I personally went to firehouses around the city to recruit firefighters. And we went to lineups at the police department, every precinct, to find out who responded, because many of them did. And we signed them up to just participate in a registry. There was no promise that there was any benefit for those individuals, because you really can't promise what would the benefit be of joining a study. We couldn't promise anything, but they did sign up. 71,000 signed up voluntarily and said, I'll be part of this, for whatever time it exists, I'll be part of it. And they continue to be part of it today. Very few, only a few percentage have dropped out since that time. But of course people over time lose interest, but there is still an ongoing intense interest on the part of people who volunteered. And that's what I'll talk about today, is what we've learned from those people who volunteered and kindly gave the time to respond to all our surveys and participated. It's challenging because we know something about the toxicology of dust, of heavy metals, lead, arsenic. We know something about the health effects of noise. Was it a noisy exposure? It was certainly a noisy exposure. You can imagine a building collapsing. It was like a thunderclap when it collapsed. Other exposures were maybe more subtle, things that you would not think about, but they were definitely there. Just gasoline or the jet fuel from the planes that crashed into the towers burned, resulted in smoke. So there's a lot of smoke for months after the event. The collapse created a pile of rubble, as probably many of you were here probably aware. A terrible odor permeated Lower Manhattan. So there were odors that triggered and sometimes reminded people of a terrible event. So there were a lot of kind of more subtle exposures that continued for months. The workers who came and were either assigned, like the sanitation workers came and helped to clean up the debris, and millions of tons of cement and other things from the buildings were put in trucks and taken to barges and then sent to landfill on Staten Island. So there was a landfill exposure that included people who were sorting the debris. As you probably remember, the Office of the Chief Medical Examiner really did a tremendous job of trying to find personal effects of the people who died. There were over 2,900 people who died in the same day on 9/11, but there were personal effects that were traced through the work of the Office of the Chief Medical Examiner. So you had a lot of workers sifting through the debris. And you can imagine that was an exposure that maybe you wouldn't think about, but being exposed to human remains is it's a sobering experience. It was something that many people are not prepared for. Luckily, the Office of the Chief Medical Examiner was well prepared for that. We're trained to deal with that kind of emotional experience. You had to treat it as a burial site, so you can imagine the kind of issues that anthropologists and archaeologists are familiar with when you do a dig in an ancient site. Same issues came up in the World Trade Center. How do you respect the dead in a way that you don't want to really you want to set it up in a way that you're respecting those people who died in this incident. So there were studies we did on the effects of people working in the landfill that try to understand what were the long-term health effects to those workers. We also then did a survey. We asked the 71,000 people what happened to them. Could they describe where they were and what they were doing, what job they might have had, or if they were in the street, where they were, what memories they had. Were they exposed to the dust cloud in a certain way, or did they have memories of other exposures? What were the psychological effects that they experienced? So we had a long survey that we interviewed them. We did this on the phone for the most part. So we also interviewed 5,000 people in person. So we were setting up what was to become a lifelong survey in a sense. And we've done now 5 follow-up surveys to try to understand every 3, sometimes 4 years since then, how are people doing? What are their current symptoms? What kind of health problems have they experienced? And then trying to understand somewhat how they're coping with this event. I think that's another aspect of following up on a disaster is understanding psychologically how people make the best of it. And as you probably are aware, being here in New York, people kind of banded together after 9/11. There was a sense of community. People helped each other out. And the same thing happened after Hurricane Sandy. There was a change kind of in New York that we understood. And I think COVID is another example that after we were exposed as a population to something, it tends to increase sometimes anxiety, but also solidarity. And I think that's something we've seen in our 71,000 people. They've stuck with us, and they're also willing to participate in following up to let us know how they're doing. Some of the issues that came up with the follow-up, one is for concern about cancer. Cancer, of course, is the long-term disease. It takes usually years to develop after a toxic exposure. How would we then set up a program to treat those people who might have cancer? That was an issue that the Centers for Disease Control, the National Institute for Occupational Safety and Health faced in about 2010. There was a bill passed in the Congress to set up clinics, more funded clinics. It's called the World Trade Center Health Program, and it was set up to fund clinics and the Registry for research, both treatment and research, going forward for the life of the people in this disaster. That's a very unusual program. The Congress, in its wisdom, funded this program. And one of the issues that was faced right away was, how do you deal with cancer? Do you wait until the 10 to 15 to 20 years go by and say, whoop, there is cancer related to this event. Now we should take care of the people. What would you do? That was the question we were all faced with. And wisely, the Centers for Disease Control, Dr. Howard, who was head of the National Institute for Occupational Safety and Health at the time, asked, what could we do? And one of my friends was a toxicologist in California I worked with, and she and a whole team of people said, what's the best thing we could do for those people who may develop cancer in the future? Set up a treatment program and a monitoring program to see if they do develop cancer, can we provide them with the treatment they need? So actually that was decided before the epidemiology could ever show anything. Because only now are we beginning to see the long-term health effects in terms of cancer, but 20 years has passed. So they set up a program that actually compensates people. It's a victims compensation program. It's so far given about $13 billion to people who are injured and people who develop cancer. And they also set up a treatment program. And that's, I think it's a kind of a national program. It's at clinics and doctors all over the U.S. who can treat and take care of the many thousands of people who are exposed and have retired. Maybe they retired from the fire department, the police department, or other people who worked on this disaster. And those people are being taken care of in a sense. Their medical care, their medications, and other things are being provided at no cost to them. Of course, their insurance may pitch in as well. But this is, I think, a unique program that was set up, and it's a model for other disasters that we could maybe use to try to make sure that there's justice for those people, because there was certainly an event that they had nothing to do with. So I think this is an ongoing program, and it is funded for the life of the people in the Registry and in the World Trade Center Health Program. So I feel a lot of responsibility for those people. I think, and I've been working on this for 20 years. There's a lot of health effects that we've been studying. What would you think would be the main health effect after 9/11? Anybody?
Asthma.
Asthma was the main physical health effect. And we've been doing studies along with pulmonologists to see what happened to the people who immediately developed asthma. There's something called the World Trade Center cough. It was developed initially and studied by the fire department. And those people, asthma in the World Trade Center is you would think, well, is it different from regular asthma? It does seem to be a little different in the sense it's harder to treat. So I think we've been trying to understand what treatment and what can we do to get people back to normal. We've been doing studies of asthma and another disease that may follow after a dust exposure or smoke exposure is chronic obstructive pulmonary disease. And that's the next thing that we're studying, try to understand long term. Are the people going to develop more lung problems that could be treated and prevented? That's something that we're still trying to study. Any other long-term health effects that you have to worry about, maybe on the mental health side? Yes. All right, post-traumatic stress disorder was something that was actually something it's been known about since maybe the Civil War because of the effects on soldiers. And after World War I and World War II, there were people who had shell shock and other consequences of being in the war. But the Vietnam War particularly raised that issue, and they developed ways of measuring it, try to understand it and treating it. So it's post-traumatic stress is usually a psychological response to a disaster or personally exposing somebody to a very traumatic event. Sometimes a motor vehicle accident or a sexual assault can cause post-traumatic stress. So it's something that any of us who have been injured can experience. Not everybody gets it. It's in the World Trade Center population, it's somewhat dependent on their occupation, whether they were trained, like the police department, among the workers had the lowest rate of post-traumatic stress. We're not sure whether that's because they were afraid to bring their symptoms forward, but certainly the construction workers and the volunteers had the highest rate. That was about 25% of the construction worker and people who were not prepared for going into a disaster. So that's a lot of people that we had to develop a treatment program for and to track them over time to see how they do. So we've done now 5 surveys to try to understand post-traumatic stress and how it either increased or some people, of course, recover with treatment. There's different treatments that have been developed, but not many of them are very effective. There's some new treatments using psychedelics. It's kind of an experimental treatment at Yale that's actually having a lot of maybe potential for the future to be able to treat post-traumatic stress by changing the memory in the brain. But I think there's a challenge. It's a very challenging disease, and it's certainly not without consequences physically. We've just done a study looking at people who had cancer after 9/11, and those people who had post-traumatic stress, in addition to their cancer, have an increase in mortality. So that compared to the general population. So it's a challenging disease. The mental health, the consequences are not just post-traumatic stress, but depression, anxiety. A lot of people were anxious, and understandably, after a disaster. Then what else could you be worried about on a long-term basis besides cancer, asthma, mental health, post-traumatic stress? Anything else that you might be concerned about? Yeah, heart disease is a really good point. Yeah, there's a lot of reasons why we think about heart disease, because this is a very stressful event. People may have lost loved ones, had bereavement. There are a lot of reasons, and there's certainly things like dust, smoke, can affect the heart. There was a study right after 9/11 that looked at hospitalizations, and indeed there was an increase right after the event in hospitalizations due to arrhythmias, other indicators. It was definitely a stress on the heart. The long term, it's something we've been studying, and we've done several studies now that do show that people who are highly exposed do seem to have increased rate of several different heart diseases. You could think about heart attacks, high blood pressure, maybe stroke. We've done several stroke studies now showing increasing stroke among the people who are survivors. So that was a very astute comment you made about heart disease. There's a compensation program and a treatment program that has to decide what the conditions are we going to treat and provide treatment for. And to go through that, we have to show evidence in epidemiologic studies and prove that it's related to 9/11. So far, we have not been able to prove that heart disease is related to 9/11. Doesn't mean it can't be done in the future, but it's challenging to make that leap. So that's something that still has to be done. Any other conditions that you'd be concerned about? Sleep apnea. Very good point. Sleep apnea is for people who, we've always thought about people who snore tremendously might be a kind of a sign that you might have trouble with your usually tongue falling back or other causes for not being able to breathe at night. And that's a very common condition in the general population, but particularly among the World Trade Center population, it seems to be a much increased sleep apnea. Very good point. Thank you for that. And there is a treatment for it, and it is recognized as a condition related to 9/11. So it's something that we have to think about. Maybe not the first thing we would imagine. How about all the noise? Hearing loss. Yeah, that's another thing that people didn't think about too much, but it was a problem. People with tremendous noise. It's like being exposed to a collapse of a mine or some other reason why there was a collapse. There may have been noise, and indeed we did a study with the fire department of people who had testing of the hearing before 9/11 and after, and we were able to show that people lost hearing. The firefighters particularly lost hearing after 9/11. Is it severe? Well, there are people now who are deaf, and it's not clear exactly. There's one of them contacted me afterwards and said, "You really need to study hearing loss," because he was a musician and he was exposed to 9/11. And he said, "I think my friends also have had hearing loss, and we wonder, is it 9/11 related?" So that triggered me doing several studies, and indeed, hearing loss seems to be one of the consequences of 9/11. Not yet recognized by the treatment program. We haven't proven it yet, but it's something that I think is really an important thing that we need to, take care of. People who were exposed need hearing aids in the future, and we need to be aware of that. And right now, they're not being compensated unless they have insurance. Luckily, now you can probably get that. Maybe I think there's a new program to get hearing aids without having to go through all the past testing, and I think in the future it'll be easier. Anything else that you'd be concerned about? Yes. Yeah, memory lapses, not being able to concentrate and being in the middle of something and forgetting, why am I doing this? That's something that's coming. It's an emerging issue that are we have several advisory committees, the community workers and scientific, and they've all brought this to our attention. That's something we need to be concerned about. Is there effects of 9/11 on cognition, we call it, or memory? That's something we're now just embarking on a series of studies to try to see, is that something, again, could it be related to post-traumatic stress? Maybe. There is some evidence that post-traumatic stress may affect people's thinking in that way. That's another thing I think we need to be concerned about. And of course, this population is aging. The average age of our registry now is 64. It was 44 when we started. So this is an aging population, and we need to be thinking ahead. What are the long-term, again, potential effects separate from the usual aging that happens in everybody? So that's, I think, the future is we're really going to have to looking at aging, cognitive impairment. Thank you for that. And also autoimmune disease is another thing that I've spent 6 years trying to tease out. Is there an effect on, is the body responding, having an allergic reaction to some of the things that may have happened that could cause an autoimmune, like mainly rheumatoid arthritis, scleroderma, or lupus. And indeed, we did a study that showed maybe there's an effect of the exposure on these diseases. Again, we haven't been able to prove it, and it seems to be largely in the firefighters. So I'll end there with just a comment about something we call post-traumatic growth. Any of you ever heard of post-traumatic growth? That's not a very well-known consequence of trauma, but it's when people may, after a trauma, severe trauma, think about my life. What's important in my life? I just went through a near-death experience. I was exposed to something that I nearly died from. Maybe what could I do differently in the future, realizing that life is short, and then maybe I can change things for the better. And that's something that happens in other traumas, but it is something we're increasingly understanding that people do make the best of a bad situation. In a sense, they reevaluate their spiritual life, they reevaluate their friendships, they realize, maybe I should pay more attention to my friends and change the way I think about every day. What do I do? What is meaning? It's about a meaning, reassessment of meaning in your life. And that's something that happened to about 30% of people after the 9/11. People said, what could I do? What could I do better, maybe in the future, and maybe I could change my life. So that's something I'm sure you've experienced with other people who have gone through severe trauma, but it's something that we're now trying to understand. What could we do to encourage that in the future with people who go through a disaster? Because I think it is something that's changeable. People can make that change if they know it exists, and there are ways of maybe encouraging that in the part of doctors, psychiatrists and other people. So that's, I think, the hope for the future. Maybe we could better understand how to encourage post-traumatic growth after these kinds of severe traumas and disasters. So I'll close with that, and happy to try to answer any questions.
Right. Thank you so much, Dr. Cohn. We have just a few minutes. If you're here in the room and have a question for Dr. Cohn, my colleague Manny Rodriguez-Leach has question cards. You can just wave him over and he'll give you one of those. If you're joining us online, you can type something into the live chat on YouTube, the comments on Facebook, or you can email me, pthompson@stbarts.org. That's PTHOMPSON at STBARTS.org. You can also use those methods if you're here in the room too. While we're waiting for those questions, you mentioned COVID a little bit earlier. I'm wondering what you've learned in your studies about 9/11 that applied to another kind of large-scale traumatic event that we went through, such as COVID.
Well, it's really good that you asked. We've done a study of COVID among the people at 9/11, and it's a really illuminating study because these are people who have had repeated very challenging health experiences. And it's one of the lessons is that people who have experienced a disaster sometimes are able to use that experience and be able to cope better with a future disaster. I think that's one of the lessons that we're learning, is that people do think about, well, what could I do better next time? And indeed they are. The other, of course, lesson is that people who were highly exposed to 9/11 also were frontline workers in COVID. And they're the people who got COVID from as an occupational disease. So that's the other unfortunate lesson, is that people sometimes they're in harm's way. People who are firefighters, police, people who do frontline workers during COVID were highly exposed, and then they, of course, were the ones that had the COVID at the highest rate. So I think it's an unfortunate thing, but it's something that, again, they do essential work, and they are hopefully trained and prepared and provided the protection that are needed to prevent it. But it is true that we are seeing that rescue and recovery workers who were frontline workers, again, were at the highest risk.
And wonders, now that we know the toxicity of just how toxic the dust was, at the time there were calls to go there and volunteer. Do you think, in retrospect, should there ever be anything like this again, officials should have done something differently and maybe quarantined the area more, kept people further away from the site?
That's really a really important question. How do you deal with people who want to spontaneously volunteer? Because they are, in our studies, they're the highest risk for post-traumatic stress. They have some of the highest rates of other long-term health effects. Those spontaneous volunteers, I think in the future we need to have some, as you said, just way of having a perimeter that allows some control over who spontaneously shows up, and then there provides, needs to be a just-in-time training for those people who may be wanting to volunteer, and providing ways of protecting them, providing adequate respiratory protection, which it was a hard thing to do at 9/11. People just ran to the site and tried to rescue people, but there are ways to protect people. We know much more about what the long-term health effects. So I think it's really important that whatever agency is responsible for setting up the perimeter, set up a way of, number one, who then goes into the site. We didn't really have a way of tracking all the people that came down and did volunteer or even were assigned. So we didn't have a way of really recording who was there to be able to then follow them up years later to see what happened. So that's the other piece, is to get some sort of registration form or ID so that we could then see who was there really. And the other is really thinking about controlling the dust. There are ways of controlling the dust through a lot of water, and that was done a little bit or somewhat after 9/11, but it was maybe done not as well as we could today. So that's the other thing, is so controlling whatever the exposures are at the source is much more effective than putting people in respirators. So that's the other lesson I think can be very important for the future.
Is there something unique you found about 9/11 or terrorist attacks like 9/11 that the long-term health effects are different than, say, a natural disaster like an earthquake or a hurricane or a fire?
That's something that we're still learning. I think I've done studies in California of fires and other natural disasters there. We didn't see quite the same degree of psychological impact of, for example, the Loma Prieta earthquake. But I think the terrorist attack has a different edge. It just creates a certain amount of uncertainty for the future, creates the anxiety, could it happen again, it could happen to me. I think that's the difference when you have something like a terrorist attack, that people do feel vulnerable and may not feel as, able to predict the future. I think that was the difference that we see. Yeah.
We have multiple questions about just how far the effects went. I know you talked about you'd even have effects from 9/11 if you watched it on TV, wherever you are in the world. But I know there was a defined area of where people were living or working that qualified them, say, to be in the registry. But what about people who lived just outside that area? What about people elsewhere in Manhattan or further into Brooklyn? How far away did you have to be to not be physically affected by the collapse of these buildings?
It's something that we're learning. In the initial phase, there was a decision. It was a political decision, really. I have to say it was not a scientific one, of deciding how big the boundaries would be for the registry, and it was Canal Street to the north for people who were physically present on 9/11, and it was below Chambers Street for people who worked and lived in Manhattan. So those are kind of narrow boundaries if you think about it. After we've learned a lot about the dust didn't respect those boundaries, and so that the World Trade Center Health Program, to its wisdom, enlarged the boundaries to include Western Brooklyn, because there were plenty of dust that went to Brooklyn, particularly to Brooklyn Heights. And there were also increased the boundaries north, so the people north of Canal Street were eligible for the World Trade Center Health Program. So that's a really good point. How do you decide who is exposed enough to maybe have some consequences physically? And we made mistakes in the beginning, I think, making maybe a little bit too narrow eligibility, and we had to recognize that, I think, as the World Trade Center Health Program recognized a bigger set of boundaries. But there's no perfect boundary, and it's a very political sometimes decision. Who makes that decision? Usually the politicians, and sometimes they don't have the scientists behind them.
We have to end shortly, but a final question. You've been doing this work for 20 years now. The registry has existed for 20 years. You mentioned the population is aging. What do the future 2 decades of the registry look like? How are you changing your work in this, now entering the 3rd decade since the attack?
That's something that we deal with every day, is what do we do with the population that has signed up? And then several thousands have died. We do follow those up. We do studies of mortality. We do matching studies to try to understand cancer with cancer registries, 11 or 12 or 13 cancer registries around the country. So it's becoming more of a question of how many people will participate in our surveys as they get age. The older people, maybe people above 90, may not be that interested in filling out surveys. This is something we've noticed. So that it's going to be a challenge, I think, to continue to follow people over the next really 50 years. The registry is set up to be following people for at least the next 50 years. And we're going to be increasingly doing matching of these people, and we've got their permission to match them to administrative databases like the mortality, and also to try to understand maybe their health conditions through matching. And we're just now trying to match our folks to things like, in the long term, things like people who participate in Medicare. We might be able to, try to find out what happened to them through matching through Medicare, through administrative means. So those are things we're trying to think about now, going to our institutional review board and getting permission ethically to do that. That's not easy. Right now we don't have permission to do that because I think there's a lot of concerns about confidentiality and privacy. But that may be the way we could, 20 years from now, people may not be filling out surveys when they're 80s and 90s. So we'll see. We do provide a web-based survey, we provide a paper survey, and we call people. So we probably make it easy to participate. But I think the future of the registry is really in trying to understand what happens to people through maybe not asking them directly, but just going through the ethical issues of how do you match them to administrative or other databases. Yeah. Thank you for that question.
Dr. Cohn, unfortunately, we have to end it there. We really appreciate you being here on this 21st anniversary.
Yeah, thank you. Thank you very much. Yeah.
And thank all of you for being here today as well. We hope you'll stick around and join us for worship in just a few minutes at 11 a.m., at which we'll be marking the 21st anniversary, and members of the New York Fire Department will be in attendance as they are each year. I also want to encourage you to join us next week for the forum. We were going to have in person our friends from St. James Piccadilly in London. They had to stay behind in London because of the Queen's death, obviously, but they will be joining us virtually next week for the forum anyway, so please do join us on St. Bart's Day next week at 10 a.m. Thanks all for being here.